and I teach people to go mouth to snout with their dogs when there's an emergency. What Dog Man's doing here is just totally awesome, and you guys rock for showing up, because a tired dog is a good dog, and one with manners is going to stay in his home for forever. So keep it up. It's just wonderful that you're doing it, and I see a lot of powerful dogs here. It's wonderful to make them ambassadors for the breed. I currently am owned by 2 Japanese Akitas, so I like big dogs, and it's important that we make people know that big dogs can be good dogs. So with that said, let me just give you a few tips about first aid, because we can't keep our dogs in a plastic bubble. Life is going to happen, and there's going to be a cut paw or an upset stomach, and I actually do a 4-hour class, so I'm not going to make you guys stay here that long. But I'm thrilled that you're out exercising at the cool part of the day, because these guys need the exercise, and especially with the temperatures we have, they can get overheated and suffer from heat stroke.
Thank you.
So it's very, very important you keep them well hydrated. Don't give them ice cold water and let them tank up on a huge bowl, but constantly give them water so that they have that hydration going. Check the nape of their neck. You can pull the skin, and if it doesn't snap back quickly, they're not well hydrated. But what I actually like doing better, and since you guys are used to being with your dogs, it should be safe, feel their gums. If they're sticky or even dry, they need water. So make sure you do that, and if they are ever overheated, the way I like to tell you to cool them off is to think from the paws up. Dogs and cats don't have sweat glands all over their bodies like we do. Basically, they have an evaporative cooling system going on right now that you're hearing everywhere, that panting. They're trying to take the cooler outside air over their tongue and into their lungs.
No.
And if it isn't cool enough outside, the only place they're really releasing heat is through the pads of their feet. So what I mean by cooling them off from the paws up is get those paws wet, the belly skin, the pits, and the groin. Some of them that don't have heavy coats, you can start wetting them on the backs, but especially if they have a heavier coat like the Shepherd, that water's going to just skim off. So you want to get the belly, the pits, the groin, and the paws wet to cool them off. Anytime a dog's temperature is 104 or higher, I don't care how quickly you cool them off, get them to the vet. Those internal organs are starting to cook, and they're going to need fluid under the skin and veterinary care. 101 degrees on average is what our pets should be. They should be slightly higher than us, and you want to take their temperature under the tail. I don't want to freak you guys out. I'm not going to take your temperature today. But you want to take it under the tail with a digital thermometer. It's nice for the dog if you lubricate the tip first. Lift the tail and insert a ½ inch to an inch. Can you see this little silver tip?
Yes.
That's where we get the temperature, not down here. ½ inch to an inch is sufficient, okay? And you want it to be somewhere between 100.4 to 102.5, so 100 degrees on average. Some other vitals you should know about are just checking your pet's breathing. The best way to do it is place your hand here on the side of the chest, or with these guys that have been exercising, you can see the movement right now. Our medium to large dogs breathe about 10 to 30 breaths per minute. Our smaller friends a little bit faster, about 20 to 40 breaths per minute. But just observe or place your hand here for that rise and fall of the chest. Ladies and gentlemen, if you were going to check for your own pulse, where would you check? Exactly, at your wrist or in the neck, the carotid artery. The best place on our four-legged friends is the femoral artery. Think of the big femur bone in the leg. Place 2 fingers at the knee and roll to the inner upper fleshy thigh. I'm sure if you guys feel this right now, it'll be a little elevated. But on average for our medium to large dogs, 60 to 160 beats per minute. So know where that pulse is on either hind leg. Don't use your thumb because you'll get your own rate, but know what's normal for your pet so you can more quickly determine when something's not quite right. Once again, our smaller breeds, our Chihuahuas and Dachshunds and stuff, might be a little bit faster. They could be, 180 or 200 if they've just been chasing their brother around the room. So know what's normal for your pet. Something else you want to know is kind of foreign to a lot of us, but it's called capillary refill time. Have you ever pressed on your nail bed and turned it white?
Yes.
And then when you remove that pressure, see the color pink come back quickly? Basically, you're judging your circulation. If you're getting a good blood flow to your fingertips, we feel pretty confident you're getting a good blood flow to the rest of your body. So you always want that color to come back in 2 seconds or less. Checking this on our dogs, though, is a little different. We don't do it at the nails. We do it at the gum. You want to lift the lip, and with the fleshy part of your finger, press against the gums until you turn it white. And then when you release that pressure, you want that color to come back in 2 seconds or less. That means he has good circulation. If his gums are pale or that refill time is slow, the animal could go into shock, which means his tissues are starting to die. They're not getting the blood and oxygen he needs, so you need veterinary help. So with that said, the first bit of homework I'm going to give you guys today is to go home and find where your nearest animal emergency center is. And the nearest one to your house, the nearest one here, nearest place you park. Because if something happens, you don't want to be worrying where it is. That's got to be a no-brainer for you. So find out where this place is. Find out what services they offer. Find out if they'll accept a credit card. The more homework you do, the less stress you're going to create, and the less stress you have, the less the dogs are going to pick up from you. So let me tell you about some of the worst case scenarios having to do rescue breathing and CPR. This can happen to a dog if he has an allergic reaction, if he's attacked and lost a lot of blood, if he's hit by a car, if he's overheated, even if he gets into certain poisons like too much chocolate. Yes, chocolate is poisonous for our dogs. So the first thing you want to do when you find a dog down is carefully approach him. Before you put your lips on this snout, you want to be 100% sure he needs your help, that he's not sleeping or dead. So as you walk towards him, stomp your feet a little bit to create a vibration that even a deaf dog would hear and call out to him. Doggy, doggy, are you awake? Then you're going to check the vitals like I just mentioned. Place your hand here on the side of the chest. Feel for the rise and fall. Is he breathing? If there's no breathing, you want to pull back on the chin to open the airway. If a dog is hunched over like this, his airway could be compromised. Think of it like your Starbucks straw. If it's bent, you're not going to get anything through. If it's straight, things will flow. So give him an opportunity to breathe on his own. But if there's still no breath, you're going to start breathing for him. Extend his tongue just a little past the canine teeth, because occasionally it rolls up and presses on the windpipe. Seal off the mouth completely. This is where it's different from human rescue breathing, because on a human we pinch off the nose and breathe in the mouth. Because dogs' smile lines go farther around their face, we don't want any air to escape, so we completely close off the mouth and we breathe directly into the nostrils, 2 full breaths. Making sure we actually ventilate, actually get air in the lungs. When we've done 2 breaths, we check for a pulse. If there is still a pulse, don't start compressing, because while the heart's working, let it do its job. So if you are still getting a pulse, just continue your breathing, and approximately every 30 seconds, recheck for a pulse. Because a dog whose lungs have been stopped long enough, the heart will stop too. At any point when there is no pulse, begin CPR. Gently take the front leg and bend it back just a little until the elbow touches the chest. That's your target zone. Sure, just bend it till the elbow touches the chest. It's kind of like you or I bending at the joint.
What's
here.
What's the purpose of that?
That points to the target zone for the heart.
Oh.
Because the heart is dead center with 2 balloons on either side known as the lungs. We want to come straight down on the heart. When you found that location, if it's a medium to large dog, place the heel of your hand here, other hand on top. Generally best to lock your fingers and elbows and begin compressing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Breathe. 1, 2. 2, 2, 3, 4, 5, 6, 27, 28, 29, 30. I'm cheating. Breathe. 1. Breathe. 2. 3, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and so on. We do 4 rounds of 30 compressions and 2 breaths, and then we recheck for a pulse. If there's no pulse, we start over. Do realize whether CPR is for a human or an animal, it's not a cure. By doing CPR, you haven't given an antidote for the poison the dog has swallowed. You haven't stopped bleeding by doing surgery. You haven't cured a disease. But by being the pump that the heart for some reason cannot be at this particular point, you keep that blood and oxygen flowing to all the tissues of the body, and you can keep his organs viable until you can get to that veterinarian who can perform the surgery, who can give the antidote, or who can cure the disease. What happens in those first few minutes can really make a difference in your pet's life.
When you do compressions like that, is it the same like when you do CPR on a human or whatever, that you might hear some crunching and so forth? Is it okay?
It's very likely that you could break a rib, but do know that dogs and cats' ribs are more flexible than ours. They do give better. But you got to think about it. If you're worried about breaking a rib and the animal isn't breathing and doesn't have a pulse, you know what's going to happen. You want to be careful, and we're not doing emergency vet like this, but you have to compress 1/3 the width of the chest. That's kind of hard to figure out, but imaginary line halfway, a little more than half. So on a really small dog, we're talking 1/2 inch to 1 inch, medium about 1.5 inches, and a large dog 2 inches or more. But it's kind of a visualization thing. Please do not go home and practice this part on your healthy pets. But if you're really doing it, you're thinking ribs, lungs, heart. Ribs, lungs, heart. It's one of those things you never really know until you have to do it. But if you're doing this, you're not doing CPR. You've got to squeeze the blood out and release so it can flow around and come back in the other chamber. Squeeze and release. And you want to keep it up at a good clip. They need a new song, but like with humans, they're saying Staying Alive or Village People's YMCA. But you know, peppy, think peppy. And there's a reason for that. Have you all ever had a blood pressure cuff on your arm? And you know when the nurse squeezes the ball, whether it's a dial or a needle, if it's squeezed slowly, the needle goes up and slides down, up and slides down. But if they squeeze this faster, it just keeps going up and up and up the needle. So think about that as far as getting the blood and oxygen to the brain. If you're peppy, you're getting it up towards the brain. In addition to doing it peppy and quick like that in the 30 compressions and 2 breaths, the American Veterinary Medical Association recently added another technique if you have a larger dog and a second person to help. And what that is what we call the abdominal push. The second person comes in here and puts a hand right here in the lower abdomen and braces the dog's back, and on the and beat pushes forward. That gives another push of blood and oxygen to the brain. We've been doing it for years without that, but if you have a second person to help, it can be beneficial. So I'll just kind of show you me, but one person can't do it, but it would be like 1 and 2 and 3 and 4 and 5 and 6 and 7 and so on. Once you've done CPR for 3 to 4 minutes, get the pet in the car and get to that emergency center or that vet that you already know where they are. There are chances, and I have had students, where they've actually resuscitated a pet. But remember, this isn't a cure-all, so the animal could stop breathing just as quickly. So even if he gets up, licks your face, and wags his tail, still get him to the vet to be checked out. It's imperative. But the more you know what's normal for your pet, the more you're likely to help him in an emergency and be able to notice more quickly when something's wrong. So every week or after your training here, go over him from head to tail. Feel for lumps and bumps. Make sure he doesn't have a bite or a cut or a burr or something, you know, in his paw, because the sooner you find something, the more likely you can fix it. Let me show you one other thing, and that has to do with bleeding. Your main thing you want to worry about if an animal ever has a bleeding wound are 3 steps: direct pressure, elevation, and pressing on a pressure point. Direct pressure would mean to grab some gauze, a clean sock, your t-shirt, whatever material you have, and apply direct pressure directly to the bleeding injury. Don't keep picking it up and looking at it. Every time you do that, you allow bacteria to get in and you scrape the clot that's trying to form. This first piece of fabric you put down, you should never remove, only the vet. If it bleeds through, add more on top. If it bleeds through, add more on top. If you suddenly have a big wad of bloody gauze, who cares? Unless you have humans that are getting wigged out. And if you're dealing with a dog emergency and you have humans that aren't being helpful, if they're freaking out, get them the heck out of here. Tell them to go take 5 around the block, or go get you a bucket of water, or go buy a newspaper. Do anything to get them away. Because animals really pick up on our emotions, so we need to stay calm at all times. Direct pressure. If you're still having difficulty getting the bleeding to stop, don't use your neighbor's cat, but a pillow. Something to elevate that area so it's higher than the heart, so that hopefully that will help the bleeding slow down. And your third course of action is pressing on a pressure point. Dogs and cats have 5 pressure points. They're major arteries. One's inside each leg, and the 5th at the base of the tail. I just introduced you to this one when we were checking the pulse. So if there was a bleeding injury here, squeeze on it. You don't need to tie it off, but again, think of it like a straw that you want to close down so less blood is lost. If it's on the front leg, come in here in the armpit. I'm sure all of you can relate to that. Have you ever fallen asleep with your big enormous brain on your arm? I knew you had the big enormous brain. And you know, your fingers get tingly. So that's what you're doing. You're diminishing the blood flow. In the tail, it's right here what we call the caudal artery, and you put the thumb on the top and 2 or 3 fingers on the bottom of the tail and squeeze to help get the bleeding to stop, coupled with the direct pressure and the elevation. When it comes time to bandage the wound, out of your happy little first aid kit, get your gauze roll or whatever you have at your disposal at that time and go round and round, but make sure it's not too tight that you can get a finger in here sideways. If you see any swelling above or below the bandage, or if the skin is starting to get cold, it's too tight. Loosen that bandage. Also a helpful tip on legs, because legs are like vertical poles. When the dog stands up, the bandage could slide down. Once you have that nicely covered, just once come around the lower abdomen and back around the leg. If it's the front leg, come once around the chest and back around the leg before you tape it off. Kind of makes it like suspenders or a garter belt. You know, it helps hold it up on the dog. And let me show you one other thing on the ears. The trick to bandaging ears is thinking opposites. Meaning, if you have a downward ear dog, you're going to flip the ear up for direct pressure. If you have an upright ear dog with a lot of cartilage, you're going to press upright ears down. Downward ears up, upright ears down. Whichever side is bleeding is where the gauze goes. Direct pressure, you've got your elevation going by holding the head up, but there's no pressure point here because we don't want to cut off blood to the brain. So now when we bandage it in place, we use the good ear as an anchor. Meaning one time we go around the front of the good ear and the next the back. Let me turn him around here. And rotate. Because if you just go around the back of the good ear, the bandage is going to fall down the neck. If you just go around the front, it's going to fall down the face. And I don't care when you have the 2 wiggle ends, meaning the tail and the ears, I don't care how much tape you use. They're going to find a way out of it. So find some old socks and cut off the toes. Ladies, pantyhose. That will hold the bandage in place better than any amount of tape until you get him to the vet. So those are just a few tips. I do teach a class that's 4 hours, so there's a whole lot more info. But does anybody have a question about something that might pertain here? Doggy Heimlich.
Oh, yeah.
You wouldn't probably, or you hopefully wouldn't have a bandaged up dog that needed the Heimlich, but let's kind of go with it. If this was a person, I'd come up behind him or her, put my fist in the belly, cover with my hand, and go 1, 2, 3, 4, 5, and that piece of steak would go sailing across the restaurant. This isn't a human. The minute I've lifted him like that, the kibble, the dog food, the bone, whatever's caught, gets the gravity assist to go farther down the throat. So what I want to do is keep him 4 on the floor or slightly tipped down. Forgive me, I know this looks a little rude. But what you want to do is the same thing. Feel where there's a triangle here. That would be the ribs. Your fist is going to go in that soft part of the belly and be covered with the other hand, but you're going to keep him like this. And the key is that your chest has to be against his back. If there's any space, you're just going to get head-butted and you're not pulling against anything. You want to make sure you're pulling against your own chest. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And it spits across the room. If it's a smaller dog, your fist might be too big. So you would just use the flats of your 2 fingers, hold him downward and push against your hand. You're very welcome. Choking is a big deal with dogs. Things go in their mouths and they don't always come out very easily. If they're making a terrible noise while they're choking, that's actually a good thing. As long as there's noise, there's an air exchange, they're still breathing. When they go quiet, that's when they're going to go unconscious. These things can happen out here. Have Benadryl and an ice pack. 1 milligram of Benadryl for every pound the dog weighs, so you need to know what the pet weighs. The smaller your pet, be more precise. 95-pound lab written down as 100, not too far off. 3-pound Yorkie written down as 5 pounds, that's almost double that dog's body weight. You would overdose him. Please take a brochure and look at some of the tips on my website, but something if you need to induce poisoning and it's a food-related item, you're going to want to give the dog hydrogen peroxide. I was just at a conference in Portland this weekend and a Yorkie ate all the sequins off the little dress, but the peroxide brought everything up. So it really can make a difference and give you that time that you don't need, because we don't have a veterinarian Velcro to our hips 24/7. And what happens, you know, in the first few moments of an injury can really make a difference between life and death for our wonderful furry friends.
How do you give that?
Shove it down their throat.
Yeah, or with a syringe out of your first aid kit, yes.
I've had to do it with her, and I read that it's 1 teaspoon per 10 pounds.
There's some discretion, but generally 1 tablespoon for every 10 to 15 pounds, but you don't want to give more than 2 doses. If you have to, then get to the vet. They have an amazing drug called apomorphine, which will make your dog throw up and throw up and throw. Right. Oh, yeah. I know those teaspoons and tablespoons get mixed up.
How much per weight?
1 tablespoon for every 10 to 15 pounds they weigh.
What about a rattlesnake bite?
Rattlesnake bite. 3 steps. Keep your pet calm, keep the wound below the heart, and get to anti-venin in 30 minutes. I actually had one in my backyard. My Akita got it right here. I'm not big on over-vaccinating, but if you do walk your dog where there are rattlesnakes or live where they are, that rattlesnake vaccination can buy you time and save you the number of vials of anti-venin you need. Keep the wound below the heart, keep the dog calm. As much as you want to run him to the vet, the faster you move him, the faster the venom will travel through the bloodstream. And get to anti-venin and call ahead. It takes 30 minutes to mix that vial of the antidote. So you want to call when you're on the way.
What do you mean by keeping the wound being underneath somewhere?
If it's on the paw, don't let the paw stay up. Keep it, you know,
But
hanging
obviously
down.
if it's above the heart, there's nothing you can.
Well, you can try to hang the head down if it's on the face, if they're
Okay.
driving on the back seat.
Okay.
How do you know if it's a rattlesnake if you didn't see it, or a poisonous snake? Puncture wound. A non-venomous snake will leave a bite mark that looks like you or I taking a bite out of a sandwich or an apple. It'll be a row of teeth or a bruise like that. A venomous snake will leave punctures. It isn't always 2, sometimes they miss. And in California, the only venomous snake we have is the rattlesnake, but there are 8 different kinds. And every 6 weeks, the rattlesnake sheds a fang. Additionally, don't think you're out of the woods if it's a baby snake. Babies are born with venom, they're born with fangs, they generally hold on longer and give you or your pet all the venom they have. The only thing is they may not issue a warning, because a rattlesnake, he's born with 1 segment to his rattle, or 1 button. Every time he sheds his skin, he gets another segment. So if he hasn't shed his skin and doesn't have at least 2 to bang together, he's not going to make a noise. And some of the adults are now learning not to rattle because it scares everybody, their prey off. So don't be fooled by that. But if you can't, you know, if you see the wound and it's punctures, it could be a rattlesnake. If you see the snake and he has a more triangular shaped head, he's probably venomous. I hope you're not close enough to see this, but if he has vertical slits for pupils like a cat, he's probably venomous too. So wound below the heart, keep the dog calm and get to antivenom.
If you don't see the snake and you don't see like teeth marks or anything, is it most likely a spider bite of some sort? If there's some swelling on a, I've had that happen. We didn't know what bit the dog.
Yeah, it probably is, and
And
you know,
all
with
the
this, and with all the spider toxins that we're hearing about lately, I would still get them to the vet because some of the, I was actually bitten by a couple black widows.
The swelling area below the
Right.
heart and all that. Okay.
And you don't want to put an ice pack on a snake bite. You may think, hey, I'm going to freeze the venom in one place, but it's doing so much tissue damage that that leg or whatever might have to be amputated. So it's better to let it flow out a little bit slowly. Don't freeze it in one place. The thing is, just learn for your pet's sake because they're depending on you. You're the advocates for them. You have to speak up. They don't say, Mom, I have a boo-boo or it hurts over here. You have to feel them up, so to speak. Get familiar with them. Really get acquainted with their bodies. I had a grooming student take my class who was trying to remove a tick off the abdomen of a male dog's body, not realizing male dogs also have nipples. So, know what's supposed to be on your pet. That didn't realize that male dogs also have nipples. So know what's supposed to be on your pet so you can more quickly determine when something's not quite right. Thank you guys.
Hey Dogman, do you know where the closest emergency is to here?
Yeah, Animal Medical Center on 4th Avenue and King Boulevard.
Okay.
Everybody got that?
Yes, thank you.
They open from 8 to 6 o'clock this evening, every Sunday. Animal Medical Center, 4th Avenue and King Boulevard, on the left-hand side. Yes.
Knowing that really can make a difference because I always say I don't teach yoga or meditation. I'm not going to get you in a Zen zone, but you need to be calm for your pets. And the more homework you do, the more information you have here can really make that stressful time less of a panic.
Seriously, I wanted one of these things so much.
Does that work for you?
Yeah, that was great. Thank you so much, Denise.
Thank you.
You're very welcome. Keep up the great work you're doing
Right.
here.
Thank you.
You're welcome. Hey, let's go home, y'all.